Assalamualaikum warahmatullahi wabarakatuh. First of all, I will introduce myself first. My name is Khadijah Hannah binti Kahar and my metric number is 12920. So in this video, I will explain about the nuclear medicine, about the external radiation therapy. So in this first slide, okay, we will talk about the external beam radiation therapy, EBRT. So EBRT is widely used for a method for treating the cancer. It involves the use of medicine outside the body to deliver the high energy rays or particles directly to the tumor. It's aiming to destroy cancer cell while preserving surrounding healthy tissues. So this precise and non-invasive approach is commonly employed for various types of cancer and requires a careful planned treatment regimen. Next, for the key differences with other treatments is for the external beam radiation therapy, how it works, it uses the high energy radiation beams to target and destroy the cancer cells from outside our body. Then for the strength of using EBRT is it non-invasive, it precise targeting of tumors, sparing healthy tissues, and it also useful for operable tumors. And there's also the limitation by using EBRT. It may require multiple sessions over several weeks, and the side effect is include the fatigue, skin irritation, and nausea. Next, how difference EBRT with the chemotherapy? Okay, for chemotherapy, it used the drug delivered via intravenous infusion or orally to kill the cancer cells throughout the body. So the strength by using the chemotherapy, it treats the cancer systematically, addressing the metastasis. Metastasis is the spread of cancer to the ability it spread the cancer to other parts of the body. And the next strength is it can be used in the combination with other treatments. And it also have their limitation which are non-targeted. It affected the healthy cells as well. And it also have their side effects like hair loss, nausea, immune suppression, and fatigue. Next, for surgery, it physically removes the tumor from our body. So the strength by using surgery, it potential for complete the tumor removal, especially if localized, and it also can provide the immediate results. But they also have the limitation, which are invasive and require recovery time, the long recovery time, and it's not suitable for all the tumors, especially the tumors near the vital organ. The last one is internal radiation therapy. So how different EBRT and the internal radiation therapy? Okay, for internal radiation therapy, it places the radioactive material directly inside or near the tumors. So the strength by using it is very localized treatment. It reducing the radiation exposure to nearby healthy tissue, and it shortens the treatment duration compared to EBRT. But they also have their limitation, which are require surgical placement of radioactive materials and it not suitable for all cancer types or their location. In this slide, we will talk about the EBRT that utilize the three types of beams, each designed for a specific purpose. So the first one is photon beams. It is the most commonly used and it can penetrate the deep into the body and are similar to X-rays, but capable to delivering the higher dose. So the second one is proton beams, which carry a positive charge and it also penetrate deeply but are more targeted. And it also can minimizing the damage to surrounding healthy tissues. So the last one is electron beams. On other hand, it ideal for the treating tumor near the surface of the body. as they do not penetrate deeply and reduce the risk to underlying the issues. So the figure of the graph below is showing the ability of the three types beams. For the first one, electron beams, and the second one is X-ray beam, which similar to photon beams, and the green one is for proton beams. So in this slide, we will talk about the stage of the treatment. So the treatment process is involved two main stage. The first one is planning and the second one is delivering during the treatment. So during the planning stage, we use the advanced imaging techniques like the CT, MRI or PET scans are used to precisely locate the tumor. And radiation oncologists also calculate the optimal dose to maximize the effectiveness while minimizing the side effect to the body. So in the second part is the delivering in the treatment session are typically delivered in a small, fractionate doses over multiple days. It allowing the healthy tissue time to recover while ensuring the cancer cells are effectively targeted. So this systematic approach ensure both precision and safety in the cancer therapy. Next, for advance in technology for EBRT, okay, the first one is intensity modulated radiation therapy, IMRT. So IMRT use advanced computer algorithm to shape the radiation beams and adjust their intensity. So this ensure the precise delivery of radiation targeting the tumor while sparing surrounding the healthy tissue. So it often used for cancer in anatomically complex regions such as brain, throat, and pelvis. So the next one is stereotactic body radiation therapy, SBRT. So SBRT delivers very high doses of radiation to small, well-defined tumors in the fewest session, typically around 1 to 5. So it used 3D imaging for precise targeting. So it applied for the lung, liver, pancreas, and brain cancer. So this the another two advanced technology for EBRT. So the third one is guided radiation therapy, IGRT. So IGRT is incorporate advanced imaging techniques like CT or MRI during the radiation delivery. So this ensure the tumor's position is accurately tracked throughout the session. So it apply for the cancer in areas prone to motion, such as lung, prostate, and abdomen. So the last one is the proton beam therapy, PBT. So proton therapy is used positively charged particles, okay, such as proton, instead of X-rays. So proton release the most of their energy directly to the tumor site, known as the Bragg peak. So it apply for brain tumors, spinal cord cancers, and pediatric oncology. So the last part is the side effect that cause from the EBRT treatment. So the first one is nausea and vomiting. So nausea is a common side effect of radiation therapy, particularly when the treatment area includes the abdomen. So vomiting may also occur. It depends on the radiation dose. So it causes the radiation irritates the stomach lining or affect the brain's vomiting centers. The second one is fatigue. Fatigue. So it one of the most common and debilitating side effect of the radiation therapy. So often described as a persistent lack of energy. So it caused by the energy diverted to repair the damaged tissue and the potential change in blood counts due to the marrow suppression. So the third one is skin irritation. So skin reactions resembling burn or rashes and can occur in the radiation field. This may include the redness, itching, dryness, and peeling. So it's caused by the radiation that damage skin cells, causing inflammation and irritation to our skins. The last one is hair loss. So localized hair loss occurs in the area receiving the radiation, such as the scalp of brain radiation therapy. So hair may regrow, but in some cases, the loss could be permanent. So it caused by the radiation that damage hair follicles in the treated area.